Hey, so my name is Stephen Johnson. I'm peer navigator for Great Moms with Corewell Health in the OB residency practice downtown Grand Rapids. Today I'm going to be going over the road of communication. We kind of look at communication with our patients as a two-way street. There's information being given on our side of the street, and there's information being given on their side of the street. And something that's important to understand is that the giving and receiving on each side of the street isn't always necessarily given and received in the same ways. I may be giving something and knowing what I'm giving, and maybe I'm receiving something in a different manner than the way they're intending for it to be received. And we're assuming that this is open communication, that this is just wide open communication. We're both giving and receiving and understanding each other, but communication is not equally given and received on both sides. And there's a number of factors that go into this. But it's just important to understand that what is said is not always what's heard on both sides. So, looking at this, we're going to start to realize that there's some barriers in communication, and we'll start with their side of the street. So, a common barrier that patients may experience, when they're dealing with substance use disorder or any type of mental health and they're seeing a healthcare provider for it is there's fear of consequences. They want to be honest, they want to be able to be open and tell you what's going on with them, but they may present with a fear that if they are honest, it could come with some consequences. Maybe there's some shame going on with them personally about their cannabis use or other drug use. Maybe they just have generalized anxiety about the visit itself. And this is going to lead to a barrier of them being hesitant to just be open and honest and flowing with their communication. There could be a history of removal. They could have had children removed from the system. They could have very valid distrust for the healthcare system in general due to negative experiences in the past, and they might have a trauma history. So when they're meeting with someone for the first time, they're asking these deep and personal questions. It's not uncommon to see someone really clam up because of these negative experiences or their trauma history, and it's something to be aware of. And then we run into people who just really struggle with identifying what they're feeling to begin with. They may not be able to articulate their thoughts very well, be able to identify the emotion they're feeling and express it, or they may have reactive mood disorders due to complex PTSD or anxiety. And maybe we're not seeing or hearing the articulation of this is what I'm experiencing right now, or this is why I'm having difficulty sharing this information with you. We're just seeing them closed off. And if we're not able to identify that these barriers exist on their side of the street, we could fall into assumption territory where we think they're just choosing not to share information with us for an ulterior motive. And then there's consequences for their family. If I tell you this information, what may happen to my children? What might happen to my home life? Is somebody going to be inserted into my life? Is it going to disrupt my family unit? There's influence from friends. There's societal judgment and stigma. Like, how are you going to perceive me now if I tell you what I'm struggling with? All these things are barriers on their side to being honest and open with their communication. And these are things that we do need to realize are going to be factors with some of our patients so we can start to address these barriers and see them when they're there. And there's so many factors that contribute to a person's tendency to struggle with open communication in a healthcare setting, giving them signals of caution to slow down or stop or just not to disclose this information. And then knowing all this with the stuff on their side of the street, we may assume that this other lane of ours is completely clear, and it is not. So sometimes, as healthcare professionals, we're a little bogged down. We have busy schedules, people run late. We may come into an appointment late. We may come in rushing a little bit to get through the screening. We may be presenting in kind of a rushed manner. This is definitely perceived by the other person, the person that we're serving, that when we're coming in, we're not really talking much about why we're late. We're trying to speed run through we'll ask the same questions all the time to the point where they kind of become like standard for us. And for them, it could be the first time in a long time where someone's asked them such deep and personal questions and wanting them to be honest about it. There's also body language, facial expressions, and mannerisms. Are we coming in using stigmatizing language? Are we talking about dirty tests? Are we using the term addict or any other language that just supports this ongoing feeling of shame with people who struggle with a substance use disorder? Um, a lot of times, what's perceived in communications is so much more than words itself. So we sometimes need to be mindful about how we're presenting with these in mind. Personal biases, judgments, and general character flaws. Like, maybe you had a family member or a partner who struggled with substance use disorder and it left a bad taste in your mouth. Maybe you personally have your own opinions on what it means with someone struggling with substance use disorder, and that presents in how you talk to them or your tone of voice or some of the things you say. And maybe you just have general character flaws. Maybe you kind of talk fast or cut people off, when they're trying to tell you something, or it could just be little quirks of your personality that could just rub someone the wrong way and kind of shut them down a little bit. So these are things on your side of the street that could kind of filter communication with some of our patients. And then controlling the narrative, trying to make it about your plan, your goal, the things you need to get done. I need to ask you these screening questions because it's part of my job. Oh, I know you're trying to talk about this issue you got going on, but let me get back to what I need from you. Or maybe they start talking about some of their concerns and you quickly dismiss it, going back to what you're concerned with. These are all barriers into honest, open communication that flows both ways. So we need to slow down and we need to address all these barriers. We can't expect to have all these barriers in place and continue to get this flow of conversation coming back and forth where we are asking questions, getting them answered. We need to stop and address these barriers. So, what can we do? Well, first, we need to focus on what we can control, and that's our side of the street. So, starting here with the rushing into the meeting, we need to do our best to respect their time and be present with them. We need to slow down, ask for consent before we begin our screening, and acknowledge any tardiness and apologize for the wait. It's pretty simple. Just be like, hey, I know you've been waiting for a while. I apologize for the wait. Let's not excuse it by saying the last person ran long. Let's not minimize it by being like, oh, this is what all doctor visits are like or all counseling appointments are like. No, let's respect their time and apologize for it. It can really go a long way and set the tone right off the bat. Slow down and ask for consent before you jump right into asking very personal questions about them. Is it okay if I ask you about your substance use? Hey, I see some things in your chart. Do you mind if we speak about that for a minute? They're so much more open when they give you the yes to complete your questioning. We need to be mindful of the body language and facial expressions. If they're telling us something difficult, if they're telling us that they've used during their pregnancy or around their other children, we need to be careful that we're not letting that show any disapproval or anything through our facial expression and our body language. We need to use common language instead of medical jargon. We want to make sure that they know we're here with them, we're talking to them in the most simple terms because the goal is for them to understand. There's really not a point in communicating with someone if they're not receiving the information. So we need to kind of talk to them in their own language and refrain from using stigmatizing language. There's a lot out there, and it is really important to stray away from those types of words and those types of judgments so that we can take a lot of the stigma away from substance use disorder and start seeing it for what it is, a medical disorder. This one can be the most difficult, but it is the most important. And this is suspending your personal biases and working to change them, not bringing your own personal judgments into the work with people, and being self aware of your character flaws and how they affect your ability to care for and relate with others. And this is one that we can all fall in the trap of, myself included, where we don't think we really need to adjust a whole lot. That if we're not connecting, that it's your problem, especially if you're looking at them through the lens of judgment, thinking that because they have a substance use disorder and it may be active, that any disconnect in the relationship is their problem, and not looking at things on your side of the street that could be improved on. Like I said, maybe you like to cut people off a little bit. Okay, that's something that could irritate anybody. And with somebody being in the room with you and you're there to care for them and there to tell you about their personal life, these aren't things we need to be bringing into our work. I shouldn't be bringing my own personal hurts or challenges or judgments from things that have happened in my past, that I'm relating to on a personal level. Those should not be infecting my work with people. I need to be suspending those at the door. And when I'm in that room, I'm talking to a person, and the goal is to help that person heal. I'm there to care for them. I'm not there to judge them. And then here we need to collaborate with the people we serve, not just control the narrative, not just say, I have a plan for you, and my goal is to make you follow this plan. Not just to say, I have all the, statistics and medical documents that say this is the best health plan for you, and I just need to beat it into your head. No, we need to sit with them and say, what is it that you want? Let's be mindful of redirecting the discussion to focus on our goals instead of what's important to them. And we need to acknowledge their concerns, not just dismiss them or ignore them when they come up, because then we're just putting barriers in the relationship. We need to be able to stop, get ourselves out of our own way, redirect ourselves back on their plan, and be with them. And even if we still want to get to the most on paper statistical healthy goal, the best path to get there is by going at their pace, being with them, meeting them at their goals, and then we can make a new goal and continue on that path. But we can't just only focus on getting them to our goal. So this is what it looks like to control your side of the street. When you're communicating with a person served. Now here we are with a clear, open end on our side of the communication street, and now we're alongside them. Now we have made it up to them, next to them, where we're meeting them where they're at. Now we're ready to start working towards their goal. Focusing next on things that we can address is their side of the street. When we're working with people, it is best to stay goal oriented, and we do this by focusing our attention on patient goals and tracking progress and celebrating wins. But when we're discussing these goals and the progress, we do still need to be mindful of spotting the barriers and addressing the barriers. We can't just keep focusing on the goal. If we focus on the goal only and we ignore all the barriers to their progress, we're just going to keep hitting bumps in the road. We're going to continue to hit barriers. It's not going to be this free flowing process. We're just going to be focused on the goal, on the goal. And we need to really slow down and focus on these barriers. So this is a little bit what it could look like versus what it should look like. When the fear of consequences come up, when the shame of their cannabis use or the anxiety about their visit, that very first barrier. It could look like this if we want to focus on the goals, where we're just insisting on pushing them to answer questions we need answered, warning them about the consequences of withholding the information. If you don't open up in here, it's not going to look good for you, or I can't help you if you don't be honest with me, and things like that, or just offering them unsolicited advice about the harm that this substance use may be causing them or their unborn child or whatever. That's just focusing on the goal, and it's not addressing the barrier that they have when they're walking through the door. So it's not going to get them to open up any better. What we could do is address their fear and ask what would help them feel safe to share. Highlight the efforts that they've made in the past to reduce their use and promote positive change. Ask what has made them feel safe before and confident about making changes with their past experiences. We need to redirect their focus back to what works instead of just focusing on the goal. We're not going anywhere with this barrier, so let's focus on what's in the way. We don't want to force them to move toward our goal through the barrier or emphasize what the barrier will result in. Like, if you allow this anxiety to continue, this is what it's going to look like for you in a bad way. No, we want to help work with them to remove the barrier. Next barrier, the history of removal, negative healthcare experiences, and the trauma history. You know, sometimes when they've had like a negative healthcare experience, we want to stick up for other healthcare workers. We want to, look at it like, oh, well, clearly it was your fault because you're this problem patient. Sometimes people can present in a way that makes us think that, but that's not always the case. And we need to take into consideration that they have these experiences and they still need healthcare. So, what are we going to do with this information? So, what it could look like, avoiding asking about their past history with CPS. It can be a touchy topic that people may not feel like they have the time or space or capacity to get into, but it's important that we do. It's important that we find out what's going on with them and where they've been and how we can best help them. You can ignore and invalidate their negative experiences about the healthcare system and other physicians, or minimize their trauma, lingering effects from it. Like, anything can be traumatic. Anything. It doesn't have to be qualified. It doesn't have to be the worst of the worst for you to say, okay, that's fair for it to be a traumatic experience. Like, anything can be traumatic. It all depends on how the person perceives it. So when someone's presenting to you with these things, this is what not to do. We don't need to be doing these things and just overlooking these barriers. Some things we can do. We acknowledge the effects of having children removed and empathize with that. I'm sure many of us can really put ourselves in those shoes and think of how hard that would be to deal with, and how much fear could be surrounding possibly saying something that could have that happen again. Even if someone we just met tells us, swears to us, it's never going to happen, there's still that fear. We could recognize that they have distrust of the healthcare system and not minimize it or defend it. We can just be curious about it. What was it that led you to that? We can validate it. We can reassure them that that's not what's going to happen here. And we can take measures to make sure we go very far out of our way to make sure that doesn't happen. Recognize trauma responses and be aware when a person's triggered. When we're talking to people, sometimes the littlest things, it could be something we say, it could be the way we say it could just be something that painfully reminds them of a time in their life where they are activated. They're triggered, they're getting defensive, they're not in the right headspace. They're not really using their executive functioning, they're in full-blown reactivity. And when someone gets to that space, questioning is over. Like, we need to stop, slow down, and address that. Make them feel safe, make them feel validated, and regroup before we try to continue communication, because it's just not possible. These individuals can be highly sensitive and reactive, so it's important to understand the severity of their history and to approach them in ways that show them something different about the system and foster an environment of safety and understanding. That's how we remove that barrier. When it comes to the difficulty in identifying emotions, the inability to articulate thoughts, these reactive mood disorders, what we could do if we want to just focus on the goal and plow through is pressuring the individual to answer, suggesting or assuming how they're feeling, skipping the important aspects of the screening due to the delay or inability to express their thoughts and feelings, labeling them as disruptive or aggressive because their mood disorder has them raising their voice or screaming or acting out, or flipping on us where we think we didn't even say anything that was that bad. I've had it happen with me where somebody just kind of flipped, and it's they're reacting to something. And no matter what it is, it's not my job to push through that for my own sake of getting my job done. It's, whoa, something just happened here. What happened? Okay, let's figure out what happened and try to make sure I'm not contributing to that happening again. So some things to do that could be helpful: allowing space for thought and expression. Silence can be a very powerful tool when we use it intentionally. Give them a second. We have so much to do. We have to ask all these questions. I have another patient to get to, but that's not fair to the person we're sitting with. Sometimes they need that space to just sit and collect their thoughts, to let the chaos kind of slow down enough to be like, what am I feeling? How can I say this? I have hesitations, these barriers, just chill out for a second. We can reflect back what we think we're hearing. What I'm hearing is this. Is that correct? So what I hear you say is this, because if we're wrong, if we're misunderstanding them, they're going to clarify it. They're going to correct us and say, no, actually, that's not what I said. And it goes back to we're not always receiving what is given 100% accurately. And we can acknowledge their reaction, show curiosity for what prompted it, own your part, and ask for clarity. And then offer them some space to center themselves. And that might even be pausing the encounter or returning to it another day or whatever they need. Um, but owning it, owning your part in it. And just, hey, I'm really sorry that I triggered you just now. Even if you don't feel it's a fault, you know, it's something maybe you said that you didn't know was going to be an ouch word or a trigger word, and it's okay to still own up to that. Sometimes this is what these people need. So allowing space for thought and expression, silence when used intentionally, and recognizing that people with a cognitive or mood disorder is triggered by certain statements, learn ways to backtrack from that. When you notice that shift, remove the barrier and step back a bit. Hey, I just noticed something happened. I want to talk about that if you want to. You know, very powerful. Instead of just reacting to their reaction, right? Like, and then consequences for family, the influence from friends, the societal judgment and stigma. We're not done yet. We still have this last barrier here. We could just try to plow right through, you know, go for the goal. We're almost there. Dismissing their concerns about the loss of their friends, even if they're bad for them, telling them why they should be more focused on their goals than their peers or their lifestyle, but for some people, this is all they have, and viewing them as a bad person for their substance use disorder instead of someone who is sick and suffering from a disorder. And this is shown through the tone used, labeling, and body language. These are not bad people. There's so much more going on there than a person continuing, a negative behavior. I don't even want to call it negative, like a destructive behavior, because it is. It's destructive for them and their lives and their family, and they know this, and it's a disorder. It's not just conscious choice to just wake up and say, I'd rather just do that today. It's not. So we need to make sure we're not viewing them as that. The more they're doing these disruptive behaviors and unable to prioritize things in their life like family and their health, that's just more evidence that their disorder is pretty unmanaged and it's pretty severe. So some things we can do to focus on the barrier rather than just trying to plow through for the goal. Ask about their family life and how it'll be impacted by their current behaviors or by making positive changes. And then ask what types of positive changes could come from treatment. Validate that their support system is valuable to them. Even if they're these friends who are no good for them, they are their friends. At one point in their life, they're probably the only people who are there for them. So even if it's something that they benefit from, putting some space in between to make some positive changes, it still hurts. It's still a loss. And we can validate that. We can highlight that their choice. Wow, it must be a really hard decision for you to make to put your health and well-being right now above these friends who have been there for you for so long. And just being conscious of using safe language, suspending our judgment, reducing the stigma talk, and using first person language when we're talking about people. There's people first. They're not just walking substance use disorders. They are people with lives, with history, with goals and desires. This is a medical disorder. So we need to avoid terms like addict, druggie, user. These all support a stigmatizing view that society has on people with a substance use disorder and just keeps them in a cycle of shame, preventing them from seeking treatment, preventing them showing up at these encounters and telling the truth about where they're at and trying to get help. People with an SUD are very aware of how they are perceived. It could be a look given by the doctor, a smile who was given by the receptionist to other people, but not to me. We need to be mindful of why we view people differently and work to change these views within ourselves. So now, with the road to communication being cleared of barriers on both sides of the street, now we finally begin the communicating with a clear understanding. And this is the starting point. Now we can start the process of trying to communicate where we thought we were going to start when we first started this, when we first walk into the room, when we're first trying to get the screening. It takes all this time sometimes to clear the barriers, to build some trust, to get some rapport with a person before we can even start. So this is the starting point, and now we're ready to go alongside them to their goals. Barriers will continue to rise at various times with all types of people we serve. Just remember to always focus on removing the barriers instead of ignoring them for the sake of the goal. We cannot just be only goal focused. We have to focus on those barriers. The most important barriers to identify and remove are the ones on your side of the street. Trust me, I know so many people are going to have a hard time hearing that. I'm telling you, and that's how I try to view things too, is if there's a problem here, I'm going to start with me. And those are the ones I have the most control over. Let them guide. Let them show you where they want to go. And you follow behind them as a support. And yes, there are times where we do need to tactfully redirect them, where their goal may be, I want to make $1 million and run away. Okay, like let me use some skills here they have other goals in mind. I don't need to tell them what their goal needs to be, but I can ask questions tactfully in a way that really digs to the root of what their true values and their goals are, and just highlight that for them. It's nothing I'm putting into their minds. It's just something I'm like, hey, let's get this out of the way real quick. Didn't you say something about how family was so important to you? Oh yeah, blah blah blah. Okay, let's talk about that. There are ways where we can guide. And that's how we get to the goal together with them. Everybody's happy. Yay. All right, thanks for watching.